Hi, my name is Malaria and I'm going to talk about parasite burden and severity of malaria in Tanzanian children. Definition: Malaria is a life-threatening disease caused by parasites that are transmitted to humans by the bite of infected female mosquitoes of the genus Anopheles. Children under the age of 5 are the most vulnerable group affected. Applications in medicine. Although almost 600,000 African children die each year from malaria, most infections in children are mild. Fundamental questions about the pathogenesis of malaria remain unresolved, such as the relative contribution of parasite burden and host inflammation to severe disease. In areas where transmission is stable, severe malaria is unlikely to occur after 5 years of age, presumably as a result of immunity, and mathematical models suggest that protection against non-cerebral severe malaria develops after 1 or 2 infections. The mechanism of protective immunity is unclear. It might, for example, involve the reduction of parasite density or the blocking of parasite virulence to prevent disease. IgG transfer from immunity adults clears blood stage, parasite and symptoms in sick children, but the target of protective IgG remain undefined. Children were classified as having severe malaria in accordance with WHO hemoglobin level less than 5 grains per deciliter, gestation, more than 1 convulsion in the past 24 hours, respiratory distress, or hypoglycemia. Children were classified as having moderately severe malaria if they did not fulfill the WHO criteria but had at least one of the following signs: a hemoglobin level lower than 6 grains per deciliter, hyperthermia, 1 convulsion in the past 24 hours, or a respiratory rate greater than 40 breaths per minute. Children were classified as having mild high-density infection if they had a parasite density of more than 2,500 parasites per 200 white cells in the absence of severe or moderately severe symptoms. Special apply in Ecuador. Malaria in Ecuador has been endemic, especially for the coastal region, where the main responsible vector has been Anopheles albuminous. Shrimp farming in this area is a suitable habitat for this species. Children who are affected for the first time present all the symptoms referred to as a fever, chills, profuse sweating, and headache, accompanied or not by nausea, vomiting, arthralgia, abdominal and back pain. In children living in malaria endemic areas, they may not have all these symptoms, but manifestations such as anemia, hypoglycemia, splenomegaly. Conclusion: resistance to severe malaria was not occurred after 1 or 2 mild infections, although the parasite burden was higher on average during episodes of severe malaria. A high parasite burden was often insufficient to cause severe malaria even in children who later were subsequent. The diverging rates of severe disease and high-density infection after infancy, as well as the similar parasite burden before and after severe malaria, indicate that naturally occurring resistance to severe malaria is not explained by improved control of parasite density.
What do you think is the world's deadliest creature and endangers human life in just 1 year? Sharks kill 12 people. Grizzly bears kill 90 people. Crocodiles kill 800 people. Hippos kill 29,000 people. Snakes kill 90,000 people. But the tiny mosquitoes kill 2 million people. and over 600,000 of these deaths are caused by malaria alone. What is malaria? It's a life-threatening disease caused by parasites and transmitted through the bites of infected mosquitoes. 3.4 billion humans, that is, half the world's population, have a threat of malaria. Why do so many people die from malaria? Why can't they go to a doctor? Why don't they get rid of the mosquitoes? Poverty. People living in poor and unhygienic places are at risk, and children are the most vulnerable. Globally, a child dies of malaria every 30 seconds. Who is at high risk? Young children, pregnant women, people with HIV/AIDS, international travelers from non-endemic areas because they lack immunity. Symptoms of malaria: muscle aches, nausea, vomiting or diarrhea, fevers, headaches, shaking chills, seizures and mental confusion, kidney failure. Malaria treatment: prevention, education, treatment. Prevention. Treated mosquito nets are the simplest and most effective way to prevent malaria. 23% reduction in malaria deaths are reported among those who use mosquito nets. Education. It is vital for any family which receives a net to also receive an education about how to use a net, how often to replace it, and how to get rid of mosquito breeding areas such as puddles, standing water, etc. Treatment. A child suffering from malaria will receive anti-malarial drugs, intravenous medication, transfusions, and breathing treatments. Let's take a look at the price of malaria. A malaria-stricken family spends 25% of its annual income on treatment. A high percentage of children's schooling impaired by absenteeism due to malaria in endemic areas. 1% malaria continues to slow economic growth by 1% every year. Did you know? Malaria is the Italian word for bad air. Malaria has been around as long as we have. Some Egyptian mummies show signs of malaria. Abraham Lincoln had it, so did John F. Kennedy. Malaria killed 1 million soldiers in the US Civil War. It killed more people in World War II and combat.
The malaria parasite's life cycle is very complex, involving many stages. As the mosquito feeds, malaria sporozoites enter into the human bloodstream. They quickly make their way to the liver and infect liver cells with the help of the circumsporozoite protein. The parasite develops into mature schizons, creating tens of thousands of merozoites, which burst out of the cell and journey back toward the bloodstream. They then infect healthy red blood cells, reproducing and eventually rupturing the cell, liberating more merozoite, which in turn go on to infect other cells, leading to the massive destruction of red blood cells. A few of the infected cells develop into gametocytes, which can remain in the bloodstream for several days and may be ingested by another mosquito during the subsequent feeding. Inside the mosquito, the gametocytes develop into new sporozoites. So now the human has infected the mosquito, the life cycle comes full circle and continues.
Hello guys, this is Indian Medico, and in this video we are going to see about complicated or severe malaria. This is a concise presentation for medical students. Malaria is the most important protozoal disease in humans. It is caused by genus Plasmodium. Almost all severe forms and deaths from malaria are caused by Plasmodium falciparum. The major complications of severe malaria include cerebral malaria, pulmonary edema, acute renal failure, severe anemia, bleeding, acidosis, and hypoglycemia. Any of the criteria, if present, with asexual parasitemia classifies malaria as severe. We will be seeing about these criteria in the upcoming slides. The clinical criteria includes impaired consciousness or unarousable coma, prostration, which means that the patient will be unable to walk or sit up without assistance, failure to feed, multiple convulsions, that is greater than 2 episodes in 24 hours, respiratory distress, which includes deep acidotic breathing, circulatory collapse or shock, which means a systolic blood pressure of less than 50 mm of mercury in children, clinical jaundice plus evidence of other vital organ dysfunction, abnormal spontaneous bleeding, and pulmonary edema, which is a radiological finding. Now let us see about the laboratory criteria. Hypoglycemia, that is blood glucose of less than 40 mg per deciliter in children. Metabolic acidosis, that is plasma bicarbonate of less than 15 milliequivalent per liter. Severe normocytic anemia, that is hemoglobin of less than 5 gram per deciliter. Hemoglobinuria. Hyperparasitemia, that is greater than 2% infected erythrocytes or 1 lakh parasites per microliter in low endemicity areas, and greater than 5% infected erythrocytes or 2,50,000 parasites per microliter in high endemicity areas. Hyperlactatemia, that is plasma lactate of greater than 5 millimole per liter. Renal impairment, that is plasma creatinine of greater than 265 millimole per liter. Now let us see about the treatment of severe or complicated malaria. Initial parenteral treatment consists of artesunate 2.4 mg per kilogram IV or IM on admission, then at 12 hours and 24 hours, then once a day. Follow-up treatment with oral medications includes artesunate 4 mg per kilogram daily for 3 days and sulfadoxine 25 mg per kilogram plus pyrimethamine 1.25 mg per kilogram on day 2. If you have any suggestions, please let me know in the comment section. For more such videos, please
This is Jeffrey Drazen for the New England Journal of Medicine. In Dar es Salaam, a 3-year-old boy wakes in the night, calling out to his parents. His mother lays her palm on his forehead, which is burning. She applies a wet cloth to his head and sings to him until he is asleep again. "I'm worried it's malaria," the father says. 2 days later, the boy's fever has not resolved. The mother brings her son to the clinic. "Is it malaria?" she asks the doctor. Doctor shakes her head. "It might be something else," she says. "Let's have a look." In many parts of Africa, malaria transmission is declining. Now that there are point-of-care, rapid diagnostic tests for malaria, healthcare providers face a new and daunting challenge. If a malaria test comes back negative, what might be making this child sick? What is the appropriate course of action? In a study reported in the journal, the etiology of fever was investigated in children in Tanzania. Just over 1,000 children under 10 years of age and with a fever of 38 degrees Celsius or higher were recruited at outpatient clinics. Blood samples and nasal and throat swabs were taken. Within an hour, malaria and a number of bacterial illnesses could be ruled out. With this information, initial treatment plans were formulated and, if indicated, treatment was started. These plans could be modified when additional results became available, usually within 5 days. The final diagnoses for the cause of fever, such as malaria, upper respiratory tract infection, pneumonia, systemic infection, or gastroenteritis, were determined through algorithms using pre-specified criteria and were not available in real time. A possible etiology of fever was identified in almost all of the children. It was a virus more than 70% of the time. For the febrile child in a third world setting, once malaria and tuberculosis have been ruled out, if there are not strong clinical indicators of a